helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Hattie Cheek, and Dr. Hettlinger is joining us today from Cabell Huntington Hospital Family Medical Center at Merritts Creek in Barboursville. And today we're talking cholesterol. What is it about cholesterol that is important for us to know?
Well, cholesterol is one of the risk factors for cardiovascular disease that we consider a controllable risk factor. So when we manage somebody's health and we manage cardiovascular disease and try to prevent cardiovascular disease, we look at various risk factors. There's risk factors that are uncontrollable, such as somebody's age or their genetics, and there's risk factors that we consider to be controllable, specifically things like cholesterol, blood pressure, activity level, things like that. Okay,
but what are the functions of cholesterol? What's the point? Why do we have it?
Sure. So obviously cholesterol is a necessary component for our overall health, but cholesterol in moderate amounts is what or normal levels is what we're shooting for. So cholesterol, it's important for the digestive process. It's important for an important component for building cellular walls. It's important for to serve as a building block for certain hormones in the body. So there are many important functions that it serves in normal levels.
Which is an important thing to note, because most people look at cholesterol and they're like, this is an awful thing, a terrible thing. I want to lower my cholesterol. But what are these different types of cholesterol that you're talking about?
So when we as physicians, we order cholesterol panels on patients, and we look at various subtypes of the cholesterol. So we look at the total cholesterol number. We look at what's known as the LDL, or the bad cholesterol number.
Okay.
We look at the HDL, which is what we know as the good cholesterol.
Okay.
And we look at another component known as triglycerides.
What are triglycerides?
So triglycerides are a form of fat that's created in the body. Mm-hmm. They are a major source of energy for our cells, but triglycerides in an excessive amount can be an indicator of somebody's lifestyle being not as good as it should be.
Right. So how do you manage that kind of cholesterol?
So cholesterol should be managed really by taking a two-direction approach. First and foremost, we should encourage people to improve their diet, increase their activity level in the form of more regular routine cardiovascular exercise, and that should be done with every patient regardless. When it becomes difficult to control with those lifestyle efforts, then we reach for medications and different forms of medications to help manage the cholesterol.
And we hear it all the time. People have trouble managing their cholesterol, so it is important to know what those factors are to keep yourself healthy. But what are some other things that are taken into consideration with cholesterol management?
Sure. So cholesterol management really entails looking at the entire component of a person's health. So we have to ask the patient and really determine, one, is there a personal history of cardiovascular disease or family history of cardiovascular disease? Does the patient, what's the age of the patient? We know that the older a patient gets, the higher risk of developing cardiovascular disease that there is. Are they a smoker? Is there ongoing uncontrolled blood pressure? Is there diabetes, uncontrolled blood sugars? So all of these things play a role when we determine how aggressively we should treat one's cholesterol.
And we were talking about this earlier. I asked you, are we focusing on men here? And you said...
absolutely not. All of these recommendations and these things relate to both men and women. The same recommendations for both.
And I asked just because growing up, I hear my mom nagging my dad about your cholesterol. You got to get it down. And
That's
then,
right.
but now we're focusing on my grandmother. So as you said, you just got to focus on different body types, different ages. And is there any other important thing that people can do to help manage their cholesterol, stay on top of it? How old should you be when you really start checking?
Well, in reality, we're finding that even younger patients in their teens and 20s are having issues with cholesterol, triglycerides. So it really I would recommend that patients or people in their 20s start having regular office visits, regular blood work to analyze cholesterol, assess their risk factors for developing cardiovascular disease.
Great. Really great information, and thank you for being here. If you want any more information, you can just head to WSAZ.com and click on Moms Every Day. We'll be right back with more Moms. Stick around.